Yeah, yes, sorry. So now I'm getting, yes. So on the topic, good evening everyone. So the topic is CD markers. Yes, it is CD markers, concepts that matter, not the number. That is what we are going to talk about. Good evening everyone. Okay, so let me start with basic understanding of CD markers. The topic is CD markers. Yes, it is CD markers concept. Okay, so now let us talk about this so, basic understanding of the CD markers. Let us talk about some basic understanding of CD markers. Let me talk about your development of your B cells and the T cell, right? So let us talk about B cell development and T cell development. B cell and T cell. B cell start their journey from bone marrow. So in the bone marrow, there are progenitor B cells. There are progenitor B cells. And these progenitor B undergo maturation into naive B cell. This will undergo maturation in the naive B cell. This is happening in the bone marrow, and this happens in first decade of life. First decade of life, and that is why, yes, if you want, you can make notes. That is always better. Yes, otherwise the video will always be available to you. Yes, so this is your, okay, so progenitor B to naive B, and this is happening in first decade. Here only applied aspect you should know. What is that? Most of the precursor neoplasms of the B cell occur in the first decade of life, right? And then this naive B cell undergoes further maturation in in lymph node and in spleen. They undergo further maturation in the lymph node and the spleen. How do they undergo further maturation in the lymph node and the spleen? Let me say, first they enter into mantle zone of the lymph node. First they will enter into the mantle zone of the lymph node. So your naive B cell enters into mantle zone, and from there it enters into center, that is called germinal center. Germinal center. And then we have one more, that will be your marginal zone. So marginal zone will end up having memory B and plasma cells. Memory B cells and plasma cells are present in marginal zone. So this is the development that is happening. Good evening everyone. So this is the development that is happening. So what is the development happening here? There is a progenitor B in the bone marrow which undergoes maturation to naive B, and naive B goes into spleen and lymph nodes where it will undergo exposure to the antigen and ultimately produces what? It will undergo further development into mantle zone, germinal center and marginal. Mantle is also known as, look at it here only, mantle zone is also called pre-germinal center. Of course, germinal center I can write short form GC, and mantle I'll be calling a pre-germinal center, and marginal zone I'll be calling a post-germinal center. Simple understanding. Why pre-germinal? Any development that happens before germinal will be called pre-germinal. Any development that happens after germinal will be called as what? Post-germinal, isn't it? So any development that happens before germinal, I'll call it pre-germinal. Anything that happens after germinal, I'll be calling it post-germinal, isn't it? Yes. So now next, let me talk about a further. Sorry, very sorry for that. My throat is very bad. Yes, so now let me talk about T cell now. T cell maturation is fairly simple, not as complex as your B cell maturation. T cell maturation, progenitor T. We'll start with this progenitor T cells. Progenitor T will be there in the bone marrow. These will undergo further maturation. They enter into the thymus. So in the thymus, they undergo maturation to peripheral T cells. Peripheral T cells. So what are peripheral T cells? Peripheral T are nothing but mature T cells. Mature T, these will go and get what? Settled in various organ. Settled in various organ like skin, lymph node, GIT, etc. They will, peripheral lymph node will go and get settled in various organs as well, isn't it? Yes. So this is what is happening in your T cell. Now let me start with the CD markers. Guys, what do you think? What is a CD marker? I say a number CD3, CD5, CD10, any number when I give. What does that tell me? Basically, all these CD markers are nothing but proteins. Every cell will be having protein. Of course, we know that many cells are having protein. Is it possible that two cells have same protein also? Yes, that is possible. Is it also possible that two cells have different protein? Yes, that is also possible. Obviously, because different cells are having what? Different functions. So their proteins can also be what? Different, isn't it? So now we should understand all these are proteins. The problem with the protein, of course, they have different names by the way, but we call them as with numbers, so that it was originally meant to make you easy to remember few numbers. Unfortunately, now we are having CD ranges from CD1 to CD 500. So, that number itself has become very huge. So now what we have done is at various stages of development of what? Different cells, we have identified different proteins that are present. And once we know that there are different proteins that are present, if that protein is present in the cell, we'll assume this is a that particular cell. For example, there is a progenitor B cell, there is a naive B cell. Do they express same protein? They can express few same protein common. They can express different also. So some proteins which are expressed only in progenitor B will be called as what? Precursor B cell marker. Anything that is expressed in naive B and can be expressed in germinal center can be similarly what? Certain proteins are expressed in each one of these regions of development, isn't it? So let me start first with okay, so how do we diagnose? For diagnosis of lymphoma and leukemia, this is where most of the people confuse lymphoma and leukemia. So I'm talking about what? Lymphoid leukemias, or together I can call them only the lymphoid. For lymphoid we use what? For lymphoid we will be using markers. For myeloid we don't use markers, isn't it? Yes. So now let us talk about, for diagnosis, very important, we require markers. Apart from markers, there are genetics and other things. We will not discuss them today. So what markers are there? Let us talk about these important markers. Yes. So what are the different markers that are there? So the markers could be one. Yes. Marker could be a lineage marker, and another is a lymphoma lineage marker. Lineage marker. So lineage marker is not specific, but it tells you what lineage it is. Is it a B or a T precursor or a peripheral, etc. Another marker will be specific markers. So these specific markers will be specific for certain lymphomas or leukemias. Okay. Yes. So let me talk about first the lineage markers then. So for lineage marker, let me start with T cell lineage marker. T cell lineage marker. Now in T cell, let me start with, so there are only two important T cell. We can divide them into, what are those two important T cell? One is a precursor T cell, precursor T. Another is a peripheral T. Another is peripheral T cell. So let us make one table to distinguish between these precursor T and the peripheral T cell. Now, so let me talk about markers first then. So what are the different markers of precursor T? Precursor T will show positivity for CD2, CD3, CD4, CD5, CD2, 3, 4, 5, CD7, CD8. Look at this. Even CD1, if you want to write, all single digit number. All single digit numbers are markers of T cell. Now, precursor T cell. They are also positive in peripheral T cell as well. What does that mean now? So tell me now, all these markers that I have written here, they are only positive in precursor T or also present in peripheral T also? Present in peripheral T as well. That means they are markers of all the T cells, not only precursor. They are markers of all the T cells, isn't it? Yes. So now let me talk about, these markers further then. In this CD3, although we have written so many markers, but for me CD3 is important. CD3 is most specific marker. CD3 is most specific marker for T cell lineage. So for all practical purposes, I need to remember what? CD3. For all practical purposes, only remember CD3. Next marker of precursor. Let me talk in precursor. It will be positive for CD10, TDT. CD10 and TDT are positive in precursor. And one more I'll write here only, CD34. All these three are positive in precursor T. They are negative in peripheral T. So important word, they are negative in peripheral T. So they are positive in precursor, but they are negative in peripheral T. So if I tell a cell is CD3 positive and CD10 positive, tell me now in the chat box, please use your chat and please tell me if it is cell is positive for CD3 and CD10, what is your inference of this cell? What is your inference from this cell? Yes, before I write the next marker, please tell me what do you infer from this? Your inference will be CD3 positive, CD10 positive. What is it? It is a precursor T or a peripheral T. Peripheral means mature, precursor means immature. We all know this. Yes, the answer is yes. What is the correct answer? The correct answer, yes, it is very good, very good, very good. Precursor T, very good. All of you right, absolutely. Okay, precursor T. Now, one more marker I'll write, the CD16. So we are having CD16, CD56. These are markers for NK cells. They are positive in NK cells. Remember, NK cells are, what are NK cells? NK cells are peripheral T cells. They are negative in precursor T. They are negative in precursor T. So now, okay, can anybody tell me a cell is positive for CD3, negative for CD10 and TDT? What are you thinking? Cell is positive for CD3, negative for CD10 and TDT. What are you thinking? Yes, you are of course thinking of what? Peripheral T. Why? Because negative for TDT and CD10 means what? It is not a precursor, isn't it? Yes, so we are thinking in that case we are suspecting it is a peripheral, isn't it? Yes. So now, so let me talk about, yes, now let me further talk about something more than, now which neoplasms arise from which? See, if I am able to know marker for precursor and peripheral, I should just know which neoplasms are arising from precursor T. There is only one neoplasm arising from precursor T. What is that? TALL. What does ALL stand for? Acute lymphoblastic leukemia oblique lymphoma. Acute lymphoblastic leukemia oblique lymphoma. So TALL is the only one neoplasm. TALL is the only one neoplasm that is there from what? Precursor. Yes, precursor. TALL. Now, what are the peripheral T cell neoplasm? Peripheral T cell neoplasm, you can remember like this. Peripheral T cell neoplasm, triple A and M. So these are your peripheral T cell neoplasms. So what are those triple A and M? So the first A stands for anaplastic large cell lymphoma. Anaplastic large cell lymphoma. A. Anaplastic large cell lymphoma, we can write short form ALCL. Anaplastic large cell lymphoma, ALCL. The second A is angiocentric lymphoma. Angiocentric lymphoma. Angiocentric is also NK cell lymphoma, by the way. Angiocentric lymphoma is a NK cell lymphoma. Then the third A is angioimmunoblastic lymphoma. Angioimmunoblastic lymphoma. And M stands for mycosis fungoides. What is mycosis fungoides? Anybody remembers? Mycosis fungoides is a T cell, peripheral T cell lymphoma. If it spreads into the blood, what is that called? If it disseminates into the blood. If it disseminates into blood. So mycosis fungoids as such is a cutaneous peripheral T cell lymphoma. Cutaneous peripheral T cell lymphoma. Yes, very good. Portier's abscesses will be seen. That will be taught to you in dermatology. So now let us talk about this. Very good. If it disseminates into the blood, we call this as Sézary syndrome. Correct? So this is your Sézary syndrome. So what is Sézary syndrome? Disseminated mycosis into the blood. Sézary syndrome. Disseminated mycosis into the blood is Sézary syndrome, right? So this is your basics of the T cell, isn't it? Okay. Now, so questions I will take at the end so that you can, have all concepts implemented as well. Okay. So now next is let me talk about the B cell. The B cell markers. Look, in B cell, it was more complex than your T cell. Why it was more complex than your T cell? B cell was more complex because we had a progenitor B or precursor B that becomes into naive B, then becomes into what? Peripheral B. Peripheral B will be having what? 3 zones. If you remember, what are those 3 zones of the peripheral B? Go back here. Mantle zone. Then you have germinal center, and then you have a marginal zone, right? So let me make a table accordingly now. So for B cell, next I'm talking B cell lineage markers. B cell lineage markers. So in B cell lineage, I'll write first precursor cell. So first is precursor B, and another is peripheral B. I have to write. So in peripheral B, if you remember, there are 3 zones. What are those 3 zones of peripheral B? Let us write. I will call them pre-germinal, pre-GC, GC, and post-GC. So what is GC here? Germinal. Pre-germinal, another name for pre-germinal, anybody? And another name for post-germinal. Sorry, another name for pre-germinal and another name for post-germinal. Please tell me. So we are having precursor. Let me make a long arrow here, little bit long, so that we end up writing more things. Then pre-germinal. Sorry, pre-germinal is there? Yes, this is your pre-germinal. Then let us write germinal also. And post-germinal we are having like this, right? Yes. Another name for pre-germinal. Anybody? Another name for pre-germinal? Mantle zone. Yes, very right. Mantle zone. Another name for post-germinal is what? Marginal zone, isn't it? Okay. So now let us talk about these 4. Basically, there are 4 zones of what? B cell development, isn't it? 4 zones of B cell development. Very good. Now, so let me start with markers first. So the first set of marker I am writing CD19, CD20, CD22, CD79A. These are positive in CD79A. They are positive in precursor cells. Yes, they are positive in precursor. They are also positive in pre-germinal. They are also positive in germinal B cell. In the post-germinal, what about post-germinal? In post-germinal, if you remember, there are memory B cell, isn't it? Memory B cells will be positive for this marker. However, there are another set of marker in post-germinal. Anybody remembers what are those? Plasma cells. Plasma cells will be negative for these markers. So in the post-germinal, memory B will be positive and plasma cells will be negative for these markers, right? So again, I can call them as a pan B cell marker. Basically, 19, 20, 22 and 79A. Pan B cell marker. Out of all these, CD19 is most specific marker. Most specific marker is what? CD19. Most specific CD19. But however, in exam or in practice, we use CD20. CD20 has more practical use. So practically we get CD20. We use CD20, not CD19. practically we use CD20 because it will also help in therapeutic purpose also. How it will help in therapeutic purpose also? Because rituximab is a monoclonal antibody to what? CD20 molecule. And if it is a monoclonal antibody to the CD20 molecule, if we want to start rituximab, we have to know whether CD20 is positive or not. That is why practically we use what? CD20. Okay, this is the fact about this markers. Now next is, let me talk about another marker. Another marker, TDT and CD34. Anybody remembers where we wrote these two marker? TDT and CD34. Yes, where else we wrote these markers? I am now writing them. Yes, correct. They are positive in precursor B cell, but they were also positive in precursor T cell. That means CD34 and TDT are not marker of what? B or T. They are markers of precursor lymphoid. Precursor lymphoid. Both B as well as what? T lymphoid will be positive for TDT and CD34. Yes, correct. Now, they will be negative in all others. Will not mention negative here. So, anything that I'm not mentioning will be considered what? Negative. Only will write the positive ones. Now, next is CD10. Anybody remembers where we studied CD10, sir? This marker CD10. CD10 was also expressed in what? Precursor T. Is also positive in precursor B. In addition, it is also positive in germinal center B. CD10 is also positive in germinal center B. So tell me now, two things I'll give you. A cell is CD20 and CD10 positive. What are your DDs? What this cell could be? Sorry. Yes, what this cell could be? CD20 positive and CD10 positive. What this cell could be? Next marker I want to write is CD5. Yes, what is your answer, sir? I am looking at the chat box. Yes, I want it to be more discussion. I'll repeat again. 20 positive, 10 positive. What it could be? What it could be? It could be, yes, very good, absolutely. All of you are right. Yes, you are right. It could be either a precursor B or it could be a germinal center B. It cannot be T because 20 is positive already, isn't it? Yes. So it could be either a precursor B or a germinal center B. Why? I said CD20 positive and CD10 positive. Tell me what is 20 positive means? B cell. 10 positive means either it is a precursor or it can be a germinal B as well. Yes, very good. Right. Absolutely. Next marker, CD5. CD5 is a marker of, where else we studied CD5? Anybody remember CD5 is a T cell marker. But however, CD5 is also positive in naive B cell. Anybody? Naive B cells are present where? In the mantle zone. Naive B cell in the mantle zone, CD5. Next marker, I want to give one more, that is your yes, one more marker is CD23 BCL6 are positive in germinal center B. They are negative everywhere else. They are positive in germinal center B, negative everywhere else. Next, one more last marker I want to give are CD38 and CD138. These are positive in, yes, plasma cells. Plasma cells don't express any markers of a B cell, but they express markers of CD38 and CD138. Now look at this application here. I want you to understand the application. Okay, tell me now. A cell is positive for CD20 and CD5. What are you thinking? A cell is positive for CD20 and CD5. What are you thinking? Question number 1. Question number 2. A cell is positive for CD20, negative for CD5, negative for CD10, negative for CD23. Tell me now, what are you thinking in these two scenarios? First one, 20 positive, 5 positive. Second one, 20 positive, 5 negative, 10 negative, 23 negative. Yes, sir. Tell me now, what are these two possibilities that I have asked you? Yes. So now I have to write examples for each one of them. Okay. What is the answer? Question number one will be pre-germinal. Yes, correct. One is pre-germinal. What about two? Post-germinal. Very good. How did you make a diagnosis of post-germinal? Look here, for post-germinal, there are no markers of post-germinal. There is only what for post-germinal memory B cell, only CD20 and B cell markers are positive, but they are positive in what? All other all other B cells as well, isn't it? Yes, very good. No, one is naive B cell, but second is not a plasma cell. If it was plasma, it would have been CD20 negative. It is a memory B. Yes, correct. It's a memory B. Yes, correct. Now, so let us talk about which neoplasms arise. See, if from the markers, if I can tell you whether the cell is precursor, pre-germinal, germinal, post-germinal, then obviously, if you give me the markers, I can tell you what is the possible origin of this neoplasm, whether it's a pre-germinal, germinal, or a post-germinal, isn't it? So let me give you a few examples. Let us write examples for each one of them. So first one, example for precursor neoplasm. Say I'm continuing in the same table. Example for a precursor neoplasm, only one. What is that? BALL. See, remember, precursor neoplasms are always the acute neoplasms. For precursor T was what? TALL. For precursor B, it is what? BALL. B, acute lymphoblastic lymphoma or leukemia. Okay. Now, neoplasms which are rising from pre-germinal. So pre-germinal, another name, we said it was what? Mantle zone. And if you remember, we have a lymphoma called mantle cell lymphoma. It is called mantle cell because the origin is from what? Mantle zone. So example for pre-germinal mantle cell lymphoma. I will write only L for the lymphomas. Mantle cell lymphoma. Next is example for germinal center neoplasms. Those arise from germinal center, which is also called follicular center as well, because it is in the center of the follicle. Follicular lymphoma. I hope all of you are now not mugging them up. Why it is called follicular lymphoma? It arises from follicular center. Why it is called mantle cell lymphoma? It arises from mantle zone. Then one which arises from marginal zone should be called as what? Tell me now. Obviously, it should be called as it will be called as marginal zone lymphomas. Marginal zone lymphoma. 100 years back, these were the only neoplasm that we were having. So, that time diseases were very easy. MCQs probably more easier that time, by the way, because only 4 diseases, not much to what break your head about, isn't it? Yes, as we have progressed, we have started with these CD markers, we have started identifying what? Different markers, so in different neoplasms. Now, let me write a few other neoplasms which arise from germinal center. Arising from germinal center, diffuse large B cell lymphoma. Diffuse large B cell lymphoma. So I'll write LY lymphoma. And one more, Burkitt lymphoma. Burkitt lymphoma. Those which are arising from germinal. Those which are arising from germinal. Burkitt lymphoma. Right? Next. Next is, yes. So let me talk about those which are rising from post-germinal. Post-germinal, remember, has two types of cells. Which are those two types of cell? What do you call memory B cell and a plasma cell. So we are talking memory B cell neoplasms now. Marginal zone lymphomas, maltoma, lymphoplasmacytic lymphoma, lymphoplasmacytic lymphoma, then hairy cell leukemia, hairy cell leukemia. Now, one neoplasm I want to write here. This neoplasm, remember, is an exceptional neoplasm. It has a dual cell origin. So what are the two cell origin? The neoplasm is BCLL SLL. BCLL SLL has a dual cell neo origin. What is the dual cell origin? Question can come from this itself. What are the two cells? One is a naive B cell, which is pre-germinal, and another is a memory B, which is post-germinal. Naive B and a memory B, post-germinal. Right? All of you clear now? Understandable, all of you? Yes. Now, so let me look at further now. One more I want to write. So these, all these until now, whatever I have written, these are from what? Memory B, isn't it? Memory B cell. The one which is arising from plasma cell neoplasm. What is the plasma cell neoplasm? The plasma cell neoplasm is myeloma. Plasma cell neoplasm will be myeloma, by the way. So I hope all of you are now clear with your basic understanding of the lymphomas, isn't it? Basic understanding of the lymphomas. Now let us talk about lymphoma specific markers. See, in the beginning itself, I told you there can be two types of markers. What are those two types of markers that can be there? Yes, there can be two types of marker. One is what? Lineage marker. Another is a lymphoma specific marker, isn't it? Yes. So let me try to look at this now. Yes, lymphoma specific markers. Why do these lymphoma specific markers occur? Most of the specific markers are due to mutation. See, in every lymphoma, there might be a different mutation, and because of different mutation, there might be different proteins that are produced. And we keep what? Observing them, and they will be used for diagnosis of lymphoma. So in lymphoma specific markers, first one, cyclin D1 and FMC7. Cyclin D1, FMC7 are markers of mantle cell lymphoma, or markers of mantle cell lymphoma. Cyclin D1, FMC7. Next marker is, okay, cyclin D1 is also called BCL1, remember. Next marker, BCL2. BCL2 is an anti-apoptotic protein. There will be a mutation happening which leads to overproduction of BCL2 in follicular lymphoma. Follicular lymphoma. Plus minus, it can be seen even in marginal zone lymphomas as well. So BCL2 can be positive even in BCL2 can be positive even in marginal zone lymphomas and myeloma. Marginal zone lymphoma and myeloma, BCL2. So I can keep writing plus minus myeloma. Even it can rarely be positive in DLBCL, diffuse large B-cell lymphoma, and Burkitt lymphomas also. These are the markers where BCL2, so looks like specific. No, it is not. It's somewhat what? Non-specific, by the way. Okay, yes. Next marker I want to discuss is annexin A1. Annexin A1 is a marker of hairy cell leukemia. Then next, one more marker, ALK1. ALK1 is a marker of anaplastic large cell lymphoma. Anaplastic large cell lymphoma. Annexin A1. Anaplastic large cell lymphoma. ALK is not annexin A1, ALK1. Annexin A1 is for hairy cell leukemia. For hairy cell leukemia, right? Next, IRTA and MNDA. IRTA1 and MNDA. They are for marginal zone lymphomas and myeloma. Marginal zone and myeloma. Next is I'm interested in CD5. Yes, tell me now. CD5. CD5 is a B cell marker and also pre-germinal center. So CD5 positivity means what? Tell me now. It could be either a mantle cell lymphoma, isn't it? So DDs for CD5 positive are, one is what? Mantle cell lymphoma. Another is a BCLL SLL, isn't it? So CD5 positive could be either mantle or BCLL. Both of them will be positive for CD5. Both of them will be positive for CD5. How do I differentiate between them? To differentiate, I can use cyclin D1. Anybody remembers where is cyclin D1 and FMC7? Both of them positive in. Both of them are positive in mantle cell lymphoma. Isn't it? Yes, both of them are positive in mantle cell lymphoma and they will be negative in BCLL SLL. Negative in BCLL SLL. Point of BCLL SLL once again, BCLL SLL has a dual cell origin. It is an exception. It arises from, it has postulated origin is both pre-germinal as well as what? Post-germinal. Another exception for CLL I will tell you. See, already I told you CLL SLL originate from what? Two cells, pre-germinal and post-germinal. Another exception for CLL SLL, it expresses markers of pre-germinal and germinal. Tell me now, what are the markers of germinal? Pre-germinal CD5 understood. Marker of germinal is CD23. CD23. CD23 will be positive in BCLL SLL and it will be negative in mantle cell lymphoma. I'll repeat again. BCLL SLL has exceptions. What are the two exceptions? One, dual cell origin. What are the two origin? Pre-germinal and post-germinal. Correct. But another exception is it expresses markers of pre-germinal and germinal because 23 is a germinal marker, isn't it? So what all can differentiate mantle from CLL SLL now? Cyclin D1, FMC7 and CD23, isn't it? Yes. However, out of all these, the most important difference between mantle and BCLL SLL, most important difference is your CD23. So most important difference is CD23. So always we go by what CD23 tells us. Always we go by what our CD23 tells us, right? Okay. Yes. So this is your basic understanding of the markers here. We have studied both lineage marker as well as what? Lymphoma specific markers. Now, can we have a look at a few questions which have come in exam previously? So let me take first those questions, then I will give you new questions as well. Okay, sir. So look at this now. First question. What you are saying in this first question. 50-year-old male presents with dyspeptic symptoms for the last 3 years. Has been taking omeprazole intermittently. Imaging shows a diffuse thickening in the wall of the stomach. Biopsy from the mass shows neoplastic cells positive for CD19, 20, 22, 79A. Can you tell me if all these are positive, what is it? Yes, if all these are positive, then what is it? Yes, sir, if all these are positive, what is it? Anybody? 19, 20, 22, 79A. So let me write this. And negative for also has been given. Let me see what are the negative markers also. Then I'll write it together and I'll explain it. Let me see. Yes. So just a minute. Yeah. Positive for 90, 20, 22, 79A. Negative for 5, 10, 23. Anybody has made a diagnosis? What is your likely diagnosis? They have asked. Yes, tell me now. What's your likely diagnosis here? Yes. So let me write the markers. What were the markers given? CD 19 positive, 20 positive, 22 positive, 79A positive. These were markers. Positive, negative for CD 5, 10, 23. Anybody? 23 also negative. Let me see how many of you got the correct answer here. Yes, let us see how many of you got the correct answer. Wow, wow, wow. Okay, Narayan Swami, your answer. How is 23 positive? I told you that is the exception for CLL SLL. Although it is arising from pre-germinal and post-germinal, it expresses markers of pre-germinal and germinal. Yes. So how do I approach this? Look at this question now. CD 19, 20, 22, 79A. What does that suggest? This is suggesting it is what? B cell neoplasm, nothing else, isn't it? It suggests it's a B cell lymphoma. It is 5 negative. What does this suggest? Tell me now. 5 negative. What does this suggest? 5 negative means it is not pre-GC. So your mantle cell lymphoma, if it was in the option B, CLL, SLL, they will be ruled out here, isn't it? These cannot be the answer. Yes. Fortunately, both of these were not in the options there, right? Next, 10 and 23 negative. What is 10 and negative? What does this indicate? 10 negative means not a precursor, and 23 negative means not even what? Pre-germinal. So it is not, sorry, not germinal, not precursor also. So your options were there: Burkitt lymphoma, diffuse large B cell lymphoma. Both of them are ruled out because both of these are what? And even there was follicular lymphoma. All these three were what? All these three are germinal center. They are ruled out. Very good, very good. Answer, easy one. Yes, very good. The answer is maltoma. Maltoma. Okay, this is a maltoma. Now, let us see the next question. Let me try to show you the next question now. Okay, so see this question. Let me see, approach this question. This is also a easier question, easy question only. Yes, tell me now. Okay, sorry, just a minute. Yeah, so tell me now, what is this answer to this question? Let me just try to, yeah, so identify what is the answer to this question. Now look at this. I'll just zoom it so that we'll be able to see it. Okay, 4-year child presents with fever, bone marrow aspirate shows large neoplastic cells with scant cytoplasm, flow cytometry shows neoplastic cell positive for 10, 19, 22, 79, 8 TDT. Again, an easy question. Yes, sir. Tell me, let me write down the markers here first for you guys. Yes, what are the markers? Let me write down the markers here. Positive for, okay, 4-year has been given. 4-year, and it is a bone marrow aspirate. So, of course, I am suspecting one leukemia now. Markers are CD 10 positive, 19 positive, 20 positive, 10, 19, 20, 22, 79A, TDT. Tell me now, what is your diagnosis? What's your diagnosis, guys? Yes, 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 yes. Very good, very good. Absolutely, absolutely. What's your diagnosis? Approach. I don't want your diagnosis, I want your approach. 19 positive. What are you thinking? B cell. Both CD 10 positive. 10 positive could be a precursor cell. Yes, it could be a precursor or germinal, isn't it? But TDT is positive means definitely it is what? Precursor. Not a germinal. So answer diagnosis will be BALL. Very good. BALL. Yeah, the question was very easy. Question was very easy. Okay, let me give myself now few more questions. No, this is not SLL, this is ALL. This is not SLL, this is ALL. Why it is not SLL? SLL is what? Precursor or peripheral neoplasm? Peripheral neoplasm. This is a precursor neoplasm. Isn't it? This is a precursor neoplasm. Yes. No, this is not CLL, SLL. This will be a what? ALL. Option B is the correct answer. Option B was B, acute lymphoblastic leukemia. Okay. Next, let me give one more. Let me see how many of you can answer this simple question. Okay. 65-year female, 65-year female, peripheral blood smear shows TLC, in peripheral blood smear TLC 22,000, differential count shows 80% mature lymphocytes. Okay, and these are positive for CD5, CD10, CD20, okay, leave 10, CD5, CD19, CD20, CD22, CD23, CD79A. Yes, sir. Tell me, what should be the answer? What is the answer here? What is your diagnosis? Okay, options I can give: B ALL, B CLL, mantle cell lymphoma, marginal zone lymphoma. These are the options here. Okay, how did you approach this? Again, see, I want you to learn approach here rather than just what mugging up. Okay, 1920 positive, what does it suggest? It is a B cell neoplasm. Then CD5 positive, what does it suggest? It is a pre-germinal. Pre-germinal, only 2 DDs, mantle cell and what? BCLL. 23 is positive, means it will be what? BCLL, SLL. Very good, BCLL. That is the correct answer, right? That is the correct answer. Yes, all of you are right. BCLL is the correct answer here, right? Next, let us look at the next question here. Okay, yes, sir. So look at this now. What is the question? 45-year-old man presents with fever, lymphadenopathy in the neck, retroperitoneal and mediastinal lymph nodes. Biopsy from the cervical lymph node shows neoplastic cell positive for CD5, CD20, CD23, 79A. Oh, not 23, sorry, 22 is positive, 79 is positive, negative for cyclin D1 and CD23. What is the likely diagnosis? What is the likely diagnosis? Option: follicular, BCLL, SLL, diffuse large B cell, mantle cell. Okay, let me write down the markers again for you guys so that we'll be able to understand it easily. Markers given to us are what? It is positive for CD5, CD20, CD22, CD79A. These are positive markers. Negative marker, cyclin D1 and CD23. Yes, tell me now, what are you thinking? Yes, let me see how many of you have got it correct. Mantle, mantle, mantle. Yes, tell me now. Mantle, mantle. I'm seeing all mantle. Someone is telling SLL. Okay, tell me. Anyone? So most of you have said mantle. Can you tell me why it is not SLL? Only one person has answered it SLL. Why it is not SLL? Okay, somebody is saying mantle should be cyclin D1 positive. Somebody is telling cyclin D1 positive. Mantle should have been cyclin D1 positive. So those who are telling CLL, SLL, yes, or those who are telling mantle cell. Okay, let me approach this. Okay, look at the approach again. 2020 to 79A, what does it suggest? B cell, right? CD5 positive, what does it suggest? Pre-germinal center B cell. What are your DDs? Either it is a mantle cell or it is what? BCLL, SLL. Yes, tell me now. To differentiate, we look for what? Cyclin D1 and 23. Correct. But most important difference. Can you tell me what is the Most important difference between BCLL, SLL, and mantle. We wrote this point already, by the way. Look at this. Most important difference is what? CD23. So whenever there are contradicting results of CD markers, go by whatever 23 tells you. Now tell me, 23 tells you it is negative. 23 is negative, means it cannot be what? BCLL. It has to be what? Mantle cell. It has to be mantle cell, isn't it? Yes, this is a mantle. The diagnosis here, this is called cyclin D1 negative mantle cell lymphoma. Cyclin D1 negative mantle cell lymphoma. And expect this question: marker for such a cyclin D1 negative mantle cell lymphoma, SOX11 is the marker. SOX11 is a marker for cyclin D1 negative mantle cell lymphoma. SOX11 is the marker for cyclin D1 negative mantle cell lymphoma. Now all of you understood? Despite this being cyclin D1 negative, I am still calling it as what? Mantle cell lymphoma. I am still calling it mantle cell lymphoma because based on what? CD23. It is based on CD23. I hope all of you are now clear how to utilize all these CD markers that are there, right? Yes. So how to utilize the CD markers, and just don't mug them up. I want you to start what? Understanding the CD markers here. Okay. Yes. So thank you all. Thank you for your patient hearing in the class. And if you are having any doubts, please put forward. So you can subscribe. Always click on the bell button of DAMS Daily channel so that you'll end up getting what? Every day. You'll not miss on any of the updates that we are going to give you. And every day we are going to have a med school that is happening in at 7 p.m. on YouTube channel. And don't forget to join our official Telegram channel as well. Yes, any doubts? Any doubts? Please put forward. Yes. Great. Thank you all. I hope all of you understood that you need not mug up. You just have to know what? Few basic concepts here. If you know few basic concepts, then what? CD markers are not your enemies anymore. Okay. So this is the most simplified way of remembering CD markers. Just remember 5 markers. 3, 20, 5, 10, 23. If you remember these 5 markers, where are they positive? You will know all the diagnosis. I'll repeat. CD3, 20, 5, 10, 23. In order only you keep looking. First look for 3 and 20, then look for 5, then look for 10, then look for 23. You will not go wrong even in one question. 100% will be your strike rate to a question which was a mammoth task for most of the FMGE students, and also for INICET, and also for Neet PG aspirants. So make sure you remember these concepts. You will end up always getting it correct. My students get 100% correct in these questions. Best wishes all of you. Keep following us. We'll see you soon. Bye bye. Good night.